And on that note, it's time for our Africa Tech segment right here on Network Africa. Now, advancement in medical science has brought great improvement to the health sector, especially in eliminating and almost extincting some diseases that once injured or killed thousands of children. Polio, for example, was most feared disease, causing death and paralysis across the country. But with the advent of vaccines, this has almost helped eliminate the disease. Despite the fact that polio immunization is free, some mothers still face the challenge of coming up with a routine culture of immunizing their children. And little mistakes like these have led to the deaths of infants, making Nigeria one of the countries with the highest death rates in the world. With the development of a health application for immunization, this is a sure way to bring great improvement to mothers by reminding them that key influencers like fathers can also receive reminders just like them, and that would help them to avoid forgetting dates that are scheduled for their children to be immunized. Well, basically, it's just a health application that reminds parents not to actually take their children for immunization so that they do not risk losing them. And for more on that, I'm being joined in studio by Akinfolarin Oluwaseun, who is an IT solutions architect, and he's also the co-founder of Immunize. That's a notification system for nursing mothers. He joins me right now in studio. Thank you so much for joining us on Network Africa, Akinfolarin.
Thank you so much for having me.
It's a pleasure. Now, we're seeing a bit of a deviation. Based on what you studied, I know you're a graduate of electrical electronics.
Oh,
so
yeah.
what made you delve into this?
Well, let's put it this way. I love solving problems, right? And computing is just a handy tool for solving problems for me, right? Electrical engineering in Nigeria is not that developed, so we don't have a facility for building circuits and all that. So, I mean, I've just not been privileged to solve that kind of problem. But what I can do, which is computing, which is programming, I try to solve some problems, and that's why I'm here, trying to solve the problem of immunization.
So why was that the problem that drew your attention? I mean, of all the apps you could create, why did you choose that one?
Well, I think it was inspired by a group of people that challenged developers. That was Private Health Alliance Network. They said, okay, you guys, you're smart. This is the problem we have in your country. This is the problem we have in Nigeria. Go ahead and come up with something very interesting, and let's see how we can support that as a permanent solution. So they had a program last year. We were part of that program. They sensitized us a lot about the problem, right? So we got thinking about, okay, how can we use what we're familiar with, mobile? We have high mobile phone penetration now. So how can we use all these things to solve this problem? So that's why I got into it. I and a couple of friends, and we have this now.
How has the feedback been? Are people loving the app, or are they?
Oh, yes. I mean, we're part of the people we're talking to Bill and Melinda Gates Foundation, and they've been on this problem for a while. They've been trying to help stop polio for a long while. They spent a lot of money, but suddenly they realized that, okay, with a platform like this that allows key influencers just talk to people, right? So that means if a woman is in a village, right, and let's say there's some sentiment that she's soaked up about immunization, you could have the mosque leader call her when her immunization date is exceeded, right? If she doesn't report to the hospital, somebody calls her, her mother-in-law can call her. Suddenly the entire world is on your case because your child is not immunized. Then you comply, right? So it's a very simple strategy. Africans, we know that they say that it takes a village to raise a child, right? This is a practical implementation of that. Right?
So the village is supposed to get a notification because
yes.
of one baby.
Yes,
is that realistic?
No, I mean that's That's the way we want. I mean, it's a life.
Yes,
right?
It's a life. My question has to do with the village context. How can this app cater to those in the rural community who might actually, I think, might have the chunk of the trouble in remembering these dates?
Yeah. The good thing is, the good news is, most of them, or a lot of them now have mobile phones, right?
What about internet access?
They don't really need internet access. It's at the point of delivery that they need internet. So at the point of delivery, the clinic would collect the data and they will send it out. We will collect that data and put it in our system, and the process is automated from there on. So they will just get phone calls because we have their mobile phone numbers now. So they don't even need the internet at all.
So you will call them?
We will call them.
Really?
We'll send them SMS, we'll call them. Then if it gets very bad, maybe they've exceeded the vaccination period by a week. I mean, we've not implemented that, but we want a situation whereby somebody can go visit and say, Mama, what's the problem now? You have not brought your child. That's how serious this application is.
I have to ask you more about what you just said. What about cases where you've done the reminding, the calls, the visits? What happens when you're just not getting that result you want?
It's at that point we default to God.
Oh my God!
God
Okay, now I have to. What funding do you have for this? Because obviously, having the app is one thing. I just heard what you said about in events where you might have to go to a person's residence. How is this being funded?
Well, it's only the digital part that we are funding, and it's funded by a small group. We have some doctors that are interested in the solutions. We have a couple of friends that say, hey, go ahead. I mean, let's see this work. But the other part will be in partnership with state governments. Okay. So we would love to work with state governments to say, okay, give us the data. If you have any problems, call us. We'll send somebody. That's
fantastic. Thank you so much.
Thank you so much.
I've been speaking with Akin Folarin-Nuwase, who he is the IT Solutions Architect, and he is also the co-founder of Immunize. That's a notification system for nursing mothers. And based on that discussion which we just had, we're asking you what your thoughts are about the immunization health application. Feel free to reach out to us either via email or Twitter. The address and handle are right there on your screen. As always, it's been a pleasure. Thank you so much for watching Network Africa right here on Channels Television. I'm Cynthia Are.